Now, while Australian politicians continue to allow child gender clinics to prescribe puberty blockers and even refer girls for double mastectomies, authorities in other nations are taking action. Last week, the New Zealand Ministry of Health joined the UK government in acknowledging there is no good evidence that puberty blockers help gender-confused children. And politicians in the South American country of Chile have blocked the use of puberty blockers on children. Joining me now to discuss these latest developments is the editor of Gender Clinic News, Bernard Lane. Bernard, thanks so much for your time. What has the New Zealand Ministry of Health found that eludes authorities here in Australia?
Well, Lyle, they've carried out a review of the evidence base. That evidence base is the same internationally, and so it's no surprise that they've concluded that the evidence for puberty blockers, cross-sex hormones for minors with gender distress is of very low quality, very low certainty. So New Zealand joins the club of Finland, Sweden and the UK, where those evidence reviews have all been carried out. In Australia, we haven't had a government or a major health authority do a systematic review of the evidence.
Now, if I read the documentation from the New Zealand Ministry of Health correctly, they're proposing some action off the back of this, aren't they?
Well, they certainly are proposing to get some headlines suggesting that there may be some action. But I think that it's far from clear that there will be more restricted use of puberty blockers or more careful use of puberty blockers. There's two documents here. There's the report of the evidence brief, and then there's a position statement from the Ministry of Health, which is aimed at guiding clinicians. And the announcements made by the Ministry of Health in New Zealand refer to a more precautionary approach to puberty blockers. Now, it's not clear what that means. No restriction has been imposed by New Zealand health authorities, and a number of the gender clinicians who had been promoting puberty blockers as safe and based on good evidence and fully reversible, a number of those gender clinicians have welcomed the position statement for the New Zealand Ministry and said effectively that it's business as usual, because they claim to be practicing in a cautionary way already.
Do you think that's right, Bernard? I mean, that doesn't seem to bear with the sort of practice that we see happening from many of these clinics.
I think there's plenty of reason to be sceptical about it. They, like the ministry, have been caught out. There's a degree of covering the tracks. It was only as recently as mid-2022 when the ministry, along with all the gender clinicians, was claiming that puberty blockers are safe and fully reversible. Now that same entity, the Ministry of Health, is telling us, well, we had no basis for making that claim.
So they're recommending a precautionary approach, which is a significant shift, perhaps. As you say, there's probably some track covering going on there. If gender clinics in Australia, I'm thinking of Queensland, Victoria, the ACT, now New South Wales, where the so-called gender conversion laws have been passed, if the gender clinics try to take a precautionary approach in those jurisdictions, could they be potentially in breach of the law?
I really don't know, Lyle. And it's one of the problems of this area is what would a precautionary approach look like that fell short of ending the routine use of puberty blockers? The problem with New Zealand is that, like those other European countries I mentioned, they have carried out an honest enough review of the evidence, and they've said that the evidence cupboard is bare. But then they have not gone to the next step, which we've seen in those European countries, which is the logical next step, which is to restrict or end the routine use of these medicines with minors. The New Zealand government are fudging it. The position statement is so vague, the talk of a new precautionary approach is so vague that the people, the gender clinicians who by definition have not been practicing in a precautionary way because they were claiming and presumably telling the patients that the evidence was good, that these puberty blockers were going to help these kids. And so they're saying business as usual. It's true that New Zealand has gone one step further than Australia in the sense that in New South Wales and in Queensland, we've had government-initiated reviews of the evidence, or in Queensland's case, a kind of an audit of the gender clinic at the Queensland Children's Hospital. And both those ventures by Queensland and New South Wales health authorities have not been open and honest about the weak state of the evidence base. New Zealand has been honest about the weak state of the evidence base. It's true that the New Zealand announcement from the ministry says that the government wants us to look at whether or not we need more regulation of puberty blockers. Now, this is a rather odd way to go about it. So they're having a public consultation whereby anyone, but presumably the kids and the parents who really want puberty blockers, can go in there and say, oh no, there should not be any more restrictions. It seems an odd thing for a health ministry to do if they've taken the trouble to look at the evidence base and they found it wanting, but then they throw up their hands and say, well, we don't really know whether or not we need tighter regulation. Let's ask anonymous people on the internet.
Yeah, it seems like there's still a long way to go in this debate, but as you say, some significant progress. You track this probably better than anyone in this country. Have there been any calls amongst the health community for a similar sort of honest review in Australia?
Yes, there have been multiple calls for some kind of review or some kind of inquiry. They've been stonewalled. There was one advice, I suppose you could call it, review and advice by the Royal Australasian College of Physicians to the former federal Health Minister, Greg Hunt. And in my opinion, that was a total misfire. The advice that was given Hunt was vague and lacking in all credibility. Gillian Spencer, the whistleblower psychiatrist from Queensland, she has been seeking a proper review, for example. The National Association of Practicing Psychiatrists in Australia has been seeking a proper inquiry. So there's no shortage of voices calling for a proper review in Australia. There's been a change of government in Queensland. It'll be interesting to see if that brings a change in the approach to this question. The Liberal Party in opposition in WA have a policy to review the use of these medicines and to pause the use of puberty blockers, I think below a certain age. The New South Wales Liberal Party at the level of the party machine has adopted a resolution which is critical of youth gender medicine. So I think that this issue is gradually becoming better known in Australia. A lot of it is still grassroots, but people who are worried about it, clinicians, researchers, parents, have been talking to their local members. They've been writing letters. So I think that, and there's more politicians aware of it now too. I mean, if you consider the situation today, there's probably, I would think, at least a couple of dozen politicians in federal and state parliaments who are quite well across the issues.
No, that's right. It still hasn't got to a tipping point as yet, but perhaps this New Zealand audit might nudge us closer in that direction. It must only be a matter of time, Bernard, before we see medical negligence cases being brought against these gender clinics, given this evidence internationally, which is all corroborated, as you said earlier. Surely those who are conducting this, what can only be called an experiment on children, they must be worried about their future liability, surely.
Oh yes, I think that behind the scenes at the gender clinics in the children's hospitals in Australia, there will have been a lot of activity involving lawyers and working out legally defensive ways of describing what they're doing in public. There have been a number of cases in the Australian Family Court which are not medical negligence, but they nonetheless have the potential to hold the gender clinicians to account and to raise the question seriously whether or not these medical interventions do serve the best interests of a child.
Bernard, our time's running out, but you've also been reporting on situation in Chile where at the political level there's been a backlash against the health advice on this. What can you tell us?
Well, what has happened is that the Congress, the Parliament of Chile, has passed a vote which prohibits the Chilean Ministry of Health from putting a specific allocation in their 2025 budget to finance puberty blockers and cross-sex hormones for minors. The situation in Chile is very interesting because I don't think I'm not aware of another situation where there's been such a rapid turnaround in the state of the debate. Just earlier this year, it was really no debate. Of course, some parents were aware of what was happening, but there really wasn't any national debate. Then there was a blockbuster media article in a national outlet by a journalist called Sabine Drysdale, and that really started to accelerate things, and she drew upon the Cass report. And then pretty soon we had a special committee of investigation in the lower house of the Chilean Congress, and it was examining public, government programs and the connection between those and medicalisation of young people. And when you read the report from the report approved by that special investigative committee, it's very well informed, it's very detailed. So in a short period of time, to a great degree because of very effective and comprehensive journalism, in a short period of time, Chile is up to speed. And, it's sort of leapfrogged Australia, I suppose you could say, because there have been concerns in Australia for some years, and some of them have surfaced in media outlets. But as I say, I think the really rapid transformation in public opinion to which those lawmakers have responded is perhaps unprecedented.
Well, I'd love to see that happen here in Australia, Bernard, and I don't think our politicians have any excuse either, just as the Chilean representatives have been exposed to good journalism. Yourself and a handful of others have been exposing this for some years now. I think it comes down to a lack of political will. But Bernard, again, just finally, South Africa is the other country you've been reporting on, and we were talking about this off air. This was quite heartbreaking to me. You've got a medical system that's overloaded with a whole bunch of issues that are obviously peculiar to developing nations, and yet there's the gender issue making demands on the health system.
That's right. I think it shows clearly that the gender-affirming medical model is or has become an American export. And it was pretty much an export to Australia, but in a country like South Africa, the stakes are much higher, because this is a country with often ineffective government, inadequate health budgets. They have massive health problems, including HIV/AIDS, kidney diseases, diabetes, lots of injuries from chronic violence. Now, at this stage, the level of gender medicalisation appears to be on a relatively small scale, and it may be that with the puberty blockers, they're mostly confined to middle-class people who can pay for private health. But at the same time, there is a push to try to get gender medicine into rural health and into the public health system. And there does appear to be a degree of medicalisation of young black and mixed race men who are thought to be, in truth, gay. So I think the situation there is very serious. The doctors who have raised the alarm about it are hoping that they can benefit from the international shift to caution overseas to head off some of the massive growth in medicalisation that we've seen in the Western world, particularly in the United States. And Australia also, I think per capita, has a very high rate of gender medicalisation of kids. New Zealand does. All the fuss that was made about the Tavistock clinic, I shouldn't call it fuss, it was justifiable concern. But per capita, the use of puberty blockers in the UK was smaller, I think, than even just the use in Queensland, and smaller than the use in New Zealand on a per capita basis.
Right. Yeah, that's fascinating, Bernard. It seems like colonialism is alive and well, but it's the progressive left that's doing it in the modern times. And of course, these countries, all countries' health systems are under pressure. Bernard, always appreciate your insights into this and giving of your time. Where can people go to follow your work, which really is cutting edge in this space? What's your Substack, and where can people go to get it?
Yes. Well, it's called Gender Clinic News, and I publish maybe 1 or 2 articles a week. If you just Google Gender Clinic News, you'll find me or my name. It should turn up. And all of my reporting is freely available, because I think this is an area where the media has failed to such a degree that there needs to be a kind of a corrective of public service journalism, because parents and clinicians have been misled by poor media coverage.
Yeah, that's a scandal of modern media. Not only is this a medical scandal, it's a scandal of journalism. And I think so many parents and ordinary Australians are so grateful to your reporting and the fact that there's an alternative media voice. Bernard, again, thanks so much for your time.
Thanks, Lyle.